Hi, everyone. Thanks for joining today's webinar. We have today with us Dustin Vanderwine of HAP, and he'll be presenting the 2021 plans. My name is Christy Strauss, and I'm one of the broker sales managers at IAD. We're pleased to have HAP is one of our carrier partners. And you're going to want to really dial in closely for this webinar because they've made some exciting changes and add-ons to their 2021 plans. Just so you know, this webinar is being recorded and we will upload it to our YouTube video library. So if you're a subscriber, you'll get an automatic notice of this upload. And if you're not, well, we will be sending all of you a link to it anyway. I do encourage you to subscribe for that auto notice. So with that being said, Dustin, I'm going to go ahead and hand it over to you.
Thanks a lot, Christy. As you mentioned, my name is Dustin Van Dyne. I'm the Director of Sales over at HAP. We are very excited about our 2021 Medicare platform. So I'm going to kind of go through all of our products, the whys of HAP, our MedSup, and so forth. If you have questions, I'd ask that you just type them in and I'll try to answer them as we go along. So first off, to start off by talking about the why HAP. So HAP, we are a nonprofit. We are not traded on a stock exchange. We actually are owned by Henry Ford Hospital, one of the largest hospital systems in Michigan. So as a nonprofit, not traded on stock exchange, what that means is we actually put our members first. We don't have shareholders to report to. We don't have to show these large amounts of revenues to make shareholders happy. We are also integrated. So we work directly with the health system, constantly finding ways to streamline care and cut costs for our members. We're also local. So we have offices still right now with everything going on. We still have offices, but in Detroit, Troy, Flint, Grand Rapids, and hopefully soon in Kalamazoo. All of our employees, for the most part, live in Michigan, which means all of the money and revenue is invested right here back in our local economy. Talk about our service area. So we are expanding. So for 2021, we will be picking up 7 new counties. So we kind of expanding to the Kalamazoo area. The 7 new counties are Barron, Branch, Calhoun, Cass, Kalamazoo, St. Joseph, and Van Buren. In those 7 counties, we are introducing one plan. It is our top selling HMO plan. That HMO plan in those 3 counties or 7 counties will include 2 of the large provider systems. So in those counties, there's 3 large providers. We will have 2, Lakeland and Bronson. We will not have Borges. So just be aware of that. Our D-SNP plan is also expanding. So for 2021, we will be in Macomb, Oakland, and Wayne. So picking up 3 counties. Currently, we are in Genesee County. Also new for next year is our PPO plan. There at the bottom, you can see we are adding our travel benefit. So you will be able to seek in-network care in all 49 states outside Michigan. So you will be able to get in-network care for providers and specialists for our PPO plan. So we're really excited about that. So I'm going to go into the details of each one of our plans, basically the ones I think from a HAP standpoint you should be selling. So the first one is our 015. This is our $0 full network HMO. It is our top selling plan. About 73% of our sales this past year have gone into this plan. I think that's going to change a little bit with our PPO being so rich, but we'll get into that in a moment. So this plan is going to be in 37 counties, including the new ones in the Kalamazoo area. It does include our travel benefit to Arizona, Florida, Texas, and Michigan. We are one of the first carriers to introduce a travel benefit. We worked out all the kinks. I've heard of some issues with some competitors, and now we're seeing even the Blue company coming out with a travel benefit. But we do include Arizona, Texas, and Florida on this. Our plan does include dental, vision, hearing, fitness, and over-the-counter. We include 2 preventative exams through Delta Dental and cleanings and x-rays. We also have Tier 1 and Tier 2 drugs covered for a 90-day supply through our preferred pharmacy at a $0 copay. We're introducing, and really excited about this, especially with everything going on with COVID, we are introducing Part D preventative vaccines covered at a $0 copay as a Tier 6. We'll be one of the first carriers to do that, so we are really excited about that. If you look at the benefits, you will see that our plan is pretty rich. 0 premium, 0 medical deductible, inpatient hospital copay. This is extremely important. What we're seeing across the board is a lot of carriers are raising their inpatient hospital copay to make up on the premium. So one thing we heard loud and clear from members, not just HAP members, but Medicare members across the state, is the inpatient hospital copay is getting too high. Most people, when they're using their plans, inpatient hospital copay is kind of one of those things that a lot more people use. Average hospital stay is just over 3 days. So you can imagine if that's hitting over 300, you're getting close to $1,000 bill when you leave the hospital. We were able to keep ours below 300. It was one of the big asks we had for our product team when developing the plans. We have seen most of our competitors now are close to that 350 range. So we're pretty excited to be below that. So one thing when talking to members, you can say, hey, with this plan, your hospital bill when you leave is below 1,000 because average stay is 3 days, and most of our competitors are now going to be over $1,000 when they leave that hospital. PCP on this plan is now 0. Really excited about that. Our ER and urgent care is inclusive. What that means is everything done in the ER or urgent care facility is covered under one copay. We've seen some competitors try copying this by doing what's called copay stacking, where they just charge you one copay, but it's the highest of the copays. It's not the same. Our providers are used to this. We've been doing this for years, but it is one copay, 90 or 60. We do have the $0 labs, over-the-counter benefit on this plan, $75 per quarter. Part D deductible. So another thing I hit on is we are seeing a lot of carriers that come out with the $0 plans having Part D deductibles on tier 3, 4, and 5 drugs. Those drugs are already expensive enough, so to then be hit with a deductible, it's usually a shock to the members. So we actually removed the Part D deductible on all of our plans. So you will not see a Part D deductible for any tier. And then obviously we have our preferred pharmacy. Copay starting at 0. We are seeing some plans that are for tier 1 now charging $2, $3, $4 for that copay. We do have $0 copays for tier 1 and $10 for tier 2. And remember, the mail order is actually 0 for tier 1 and tier 2. So this is our best selling plan. Obviously, you can see why it's an extremely rich plan. And I think that's going to continue into 2021 as we see the market and competition getting tougher. Next plan is our primary choice. So this plan has been, we launched it 2019. It's been pretty successful for us. It was actually designed by providers. So a couple years ago, we decided to go, being owned by hospital, we decided to go directly to the providers and say, you know, if you were putting your family members or you're buying a Medicare plan yourself, what would you want? And this is basically the plan they designed. It was one of the first actually provider designed plans. I've now seen a couple other carriers in Michigan and outside Michigan come up with similar plans. We've actually been in meetings across the country where we're presenting what we did design this plan. So this plan is available in 7 counties. So you basically have like the Jackson, Livingston area, and then Macomb, Oakland, Wayne area that you can sell this plan in. And the reason Jackson is we own the hospital system in the Jackson area. But this does include our travel benefits. So Arizona, Florida, Texas. It does include the dental, vision, hearing, fitness over the counter, 2 preventative, mail order drugs, $0 copay. One thing we did to change on this plan is it used to cover tier 1 and tier 2 drugs to the donut hole. They did have to remove that. We'll talk more about that in a minute, but they did have to remove that. We are also covering vaccines, your preventative vaccines at a $0 copay. This plan does require referrals. So it's the only plan that we have that needs referrals. And it was because the plan was designed by doctors. And obviously, as the primary care physicians designed it, they said they wanted to work more closely with their patients in coordinating care. So you do have to get a referral. Because this plan is narrow on the PCP, so it was designed by providers. It is a select group of primary care physicians, pretty large. It's almost 800, so it is pretty large. But these doctors basically are going to be narrow on the PCP. For specialists and hospitals, it is our full specialist, full hospital network. Because it's narrow on the PCP, you can see there the copays are actually lower than our other plan. So you'll notice that, for instance, the inpatient hospital is $235. It's one of the lowest ones in the market this next year. Your over-the-counter benefits higher at 100. So it is a very rich plan. And then for those people that travel the world, this plan actually has no worldwide emergency coverage cap. Most Medicare Advantage and Med Sup plans cap it at $50,000 for worldwide emergency coverage. This plan actually has no cap. The next plan is our $0 HMO medical only. And this plan has been very successful with veterans. So when working with the veteran community, the ones that have Part B, usually they just use the VA system and they're not picking up any other type of Medicare Advantage plan. So we actually designed this plan a couple years ago around veterans. It's a $0 premium. It does not include medical because they already have it through TRICARE in most situations. And I would tell you, if they don't have their Part B, don't have a veteran pick up a Part B just to get this plan. But if they do, this plan is a 0 premium. We actually give them $50 per month on the Part B rebate, and it's automatic through Social Security. So they'll see their Part B each month reduced by $50. From a Part B rebate, it actually is one of the highest of all the plans offered in Michigan. This plan, like when you're talking to the veteran community, they're going to say, well, I don't really need it. I use the VA system. Well, this gives them all the extras, the dental, the vision, the hearing, the gym membership, the over-the-counter. So these are things, okay, you don't need it, but you might as well take it because you're getting $600 off your Part B, plus all the extra benefits. We've also seen a lot of people that are on original Medicare, and they don't want to make any changes because they don't want to pay that Part D penalty for not having coverage. Well, they can pick up this plan. It doesn't impact their Part D, so they still don't have a penalty there. But now they're getting all their extra benefits, plus they're having their Part B reduced by $50 a month. So we love this plan. So hopefully if you are talking to people that original Medicare or veterans, this is the plan you show them. Henry Ford Tiered Access Plan. This is our narrow network Henry Ford plan. It does have a premium of $95 a month. Because it has a premium, we don't sell a lot of it, so I'm not going to spend time on it. But if you do run into people, you'll have this presentation. You can kind of look through this. But most people now are buying $0 plans. POS, I am really against POS plans, so it gets me in trouble sometimes, but I call POS basically what they stand for, POS. And the reason I'm not a big fan is they get agents in trouble. And what I mean by that is a POS has a very limited out-of-network benefit. And most people, once they buy the plan, they don't remember what the agents told them. They say, hey, I have an out-of-network benefit, and they go and use it. In reality, it's very limited. So like HAP gives them $1,000 out of network, is it? A lot of other carriers will give them unlimited out-of-network benefits. However, they have a separate medical deductible and no max out of pocket. So you could have someone spend $30,000 out of network on a POS plan. So I've always cautioned agents when selling POS plans not to talk about the out-of-network benefit. We have 2 POS plans. They are premiums. They have $70 or $85 for this plan. And you'll see we don't spend a lot of time designing them because this plan actually has a deductible. It's one of the only plans we have with a medical deductible. But the copays are very low. So if you sell the plan based on the copays and not the out-of-network benefit, you'll be okay. But again, I just tell agents to stay away from POS plans so you don't get yourself in trouble. If they want it out-of-network benefit, sell them a PPO. If they don't care, sell them an HMO. PPO, this plan I am really excited about. I am pushing for this to be the top selling plan in Michigan this next year. I know Priority has been bragging about their PPO this past year being the top selling plan. And the only difference between our plan and theirs was we didn't have the travel benefit. So now that we have the same travel benefit covering all 49 states, plus we've been doing it a lot longer, so we know how to work with the providers in other states, we are really excited about this. So the way the benefit works is if you are outside of Michigan, you have full coverage in network for any doctor that accepts Medicare. If you are in Michigan and you see a doctor out of network, that's when the out of network benefit falls into play. So only time you're going to hit those out of network costs, like the 30% co-insurance, is if you're in Michigan and you go out of network. Outside of that, everything's covered. Emergencies are covered worldwide, urgent care, and so forth. So very rich plan. And again, I think it's really us and Priority that are doing the national network when it comes to these PPO, these $0 PPO plans. This plan does include dental, vision, hearing, gym membership, the over-the-counter. We give them 2 preventative exams, tier 1 and tier 2, 90-day mail order supply, $0 copay again, the $0 vaccines, $0 PCP, the $0 mental health, inpatient hospital, one of the only PPO plans, $0 PPO plans to have an inpatient hospital below 300. We're one of the only plans for the Part D deductible to have no deductible for any tier. So again, very rich PPO for a $0 PPO. And I think you guys, from a selling standpoint, this should be your top choice. The biggest difference between us and the green company is going to be that inpatient hospital. Outside of that, the plans are pretty similar. So that's really what you're looking at. And then we do for a $60 premium, you can obviously get the copays reduced. Our West Michigan plan, if any of you sell in the Grand Rapids area, This is a plan we've had this past year. We actually partnered with the Mercy Health System. So it's been very successful. They've kind of pushed our plan ahead of the rest of the plans. We have a really good relationship with them. It was actually one of the fastest growing new plans for 2021. And if you look at the benefits, you'll see why. So it is available in only 4 counties: Kent, Ottawa, Oceana, Muskegon. It has the travel benefit, all the extras that we've been talking about: the dental, vision, hearing, fitness, the mail order drugs. This plan actually does cover tier 1 and tier 2 drugs through the donut hole, the $0 Part D vaccines. There's no referral. And if you look at the copays, they are extremely low. So 0 PCP, 0 deductible, 235 inpatient, and then labs, PT, OT, ST, all 0. Radiology is only 25, so very rich benefits. And again, if you have questions, you can type them in and I will try to answer them as I go along. And then again, we have a $30 HMO plan in the West Michigan area, and then obviously copays are reduced. DSNP, so we're expanding our DSNP. So it's been pretty successful in Genesee County. We are going to expand to Macomb and Oakland, Wayne County. So one thing we are doing with our DSNP is we are investing heavily in the coordinating care. So if you're looking for all the supplemental benefits, this is not the plan. This is the plan that's going to coordinate closely with the member, help them through any of their medical situations they have. So we're investing heavily into that coordinated care versus all the extra benefits. So if you want the plan that's going to care for your member, that's what we're designing here. So our DSNP plan, they do have to be a full dual to buy it. So QMB plus, SLMB plus, and FBDE. If you don't know what they are, you can call our hotline or text myself or Jason, who's our Medicare consultant, and we can actually find what level of Medicaid they are. We are going to include our full HMO network, so they can use our full Medicare Advantage HMO network. So pretty much all the hospitals in the counties we're in. In those 4 counties, it is all the hospitals. Transportation, this will have 24 one-way trips. We give them a $2,000 benefit for Delta Dental. This does not include dentures, bridges, crowns, and onlays. Medicaid, for the most part, picks that up. So it's really covering the preventative, which is where the gap is. We give them a $200 allowance for vision, $1,000 allowance for hearing aids. And since they're full dual, you'll notice there's actually 0 cost for everything. Pharmacy, so since we're not traded on a stock exchange, we are allowed to invest a lot more of our revenue back in the plan into our formulary. So we probably have one of the most comprehensive formularies out there. So we talked about the mail order drugs, $0 tier 1, 2 through Pharmacy Advantage. We have the preferred pharmacies. We have all of your major franchises except for Walgreens. And then our formulary, so some of the things that we do differently is we include some of the major brand name drugs as a tier 2. So like Novolin, Novolog, Lantus, which are insulin drugs, ProAir, which is an inhaler. We include those at tier 2. So on a 90-day mail order, you can actually get those at a $0 copay. And then we also have drugs that a lot of companies will include as a tier 4 or 5 as a tier 3, such as Advair and Breo and so forth. So very rich formulary. Part D senior savings model. So really excited to talk about this. So the Part D senior savings model, I'm sure you've heard it from other carriers. CMS and politicians work on designing this to reduce costs for people that have diabetes. So this is for insulin. It's insulin on our formulary. So one thing we're doing different than our competitors is we're actually including the Part D senior savings model on every single plan. Most carriers are only putting it on one plan of their choice. We actually included it on all plans except for DSNP, because DSNP follows LIS rules. So all of our plans will have this. It's for insulin that's on our formulary. Basically, the way it works is that we will cap them at $35 copay for a 30-day supply through all Part D phases. So even through the donut hole, the most they'll pay is $35. So for example, if they're on Novolog or Novolin, so they're on one of those insulins, and they're doing a mail order, they'll get it for a $0 copay. They hit the donut hole. Right now, it probably jumps to $150, $200, usually hitting it in the 3rd month. They're going to pay $150, $200. Next year, they'll pay $35 max. To jail, tier 3, same thing. They'll be paying a copay because it's a tier 3. Once they hit the donut hole, they're capped at $35. So we are really excited about that, and we're excited by the fact that our product team decided to put it on all plans, not just certain ones. Part D vaccines. So these are your preventative vaccines. We're one of the first carriers to do this. We'll include all of these at a $0 copay. Since it's a Part D vaccine, needs to be picked up at a pharmacy, but the vaccines include shingles, hepatitis A and B, measles, mumps, rubella, meningitis, influenza, and pneumonia. So really excited about that. Extra benefits, we kind of talked about preventative dental. So we have Delta Dental. They get 2 exams, 2 cleanings, and their x-rays every year. We have vision through iMed. So they get their routine eye exam at $0. We also give them a $125 allowance for contacts, glasses, frames. This is higher than most competitors. Most of them are around $100. We have Nations Hearing for hearing aids, and they get 2 hearing aids per year at a flat copay. And you can see the copay range there. And then we have the over-the-counter benefit. So 45 to 100, depending on the plan, it's per quarter. They basically get a catalog in the mail, or they can go online or by phone, and they can order it. They receive it in between 3 and 5 days. It's to cover things such as like dental care, allergy, cold, flu, ear, eye, vitamins, and so forth. There's about close to, I think, 800 items in the catalog. So it's pretty large, and the members say they love it. We have telehealth, $0 copay for telehealth. Now they can do behavioral health through that, and we're actually adding dermatology, but that's going to be at a specialist copay. Talked about the travel benefit. So Florida, Texas, Arizona on the HMO plans, all 49 states outside of Michigan on the PPO plans. We have the Assist America, which is worldwide medical emergencies. So if they need a translator, they lose their luggage, or even something worse happens, Assist America can step in and help them out. Gym membership. So I'm really excited about our gym membership. This was a huge investment for us. We did a lot of research. So we were with Silver and Fit up until January 1st. We've done the Silver sneakers, and it just seems like these gym memberships have become stale. And especially when COVID hit, we didn't see anything changing. So we had all these members, and we're paying a fee for every one of these members, and there's no gyms they can use, and the online service just wasn't there. So we started doing a lot of research and trying to find a company that was extremely innovative when it came to online presence and then the gyms they included. So we found a company called PureFit Move. And PureFit Move is a pretty large company, and they actually are partnered with all your major franchises. So this is a gym membership that our clients will actually be able to go to Lifetime or Orange Theory or LA Fitness or Planet Fitness or YMCA. So the PureFit Move is a very rich benefit, but what's nice about them is they also have a whole online presence. So our clients will be able to do like studio classes or virtual classes or day passes, or they can get at-home kits. They can do a program called Burn Along, which is kind of like at your home watching videos online. They have memory fitness programs to help with your memory and mind. So very rich benefit. It was a huge investment for us. So I think this is going to kind of separate us from our competitors. Our clients will get 32 credits. So for example, Lifetime Fitness is 24 credits. So they can do that along with like a fitness class, a virtual class. They can get yoga mats and so forth. Our plans also include mom's meals. So like if they get sick, they're admitted to the hospital for like congestive heart failure, diabetes, hypertension. Once they're discharged, they can get up to 28 meals. It's a 14-day supply, 2 meals a day. We have Livongo. So for all of our clients with diabetes, this program is actually, we've seen reduced numbers for diabetes. We've also seen the hospital admission related to diabetics actually get reduced because of this program. So Livongo is included on all of our plans. They get unlimited free test strips, Lancets, a free glucometer. So it's a diabetic management system. We also do $0 podiatry exams. So when it comes to diabetes, between the insulin we're giving out and this program, we are the plan of choice. We include acupuncture as well as a $0 copay. For chronic low back pain, we have Healthy Living Rewards program. So they get gift cards for getting preventative tests done, such as colonoscopies and mammograms. We have nutritional counseling. So if they have a medical illness related to diet, we can help them out with that at no cost. We have smoking cessation programs. So if they want to stop smoking, we have programs for that to help them out with that. And then we have low copays for many other things. Again, once you start reading into the summary of benefits, this is where it's going to separate us from our competitors because we don't have to invest the money back into our shareholders. We do have an optional buy-up dental. So if you need more than the preventative exams you're getting, you can purchase additional dental. 3 plans, Delta 50 and Delta 70 are the 2 plans I like. We have no waiting periods for any services. Those 2 plans give an $800 and $1,500 max benefit, and it covers everything, including crowns, bridges, dentures, and implants. So very rich benefit. We did add the new Delta 25. It's a $2,500 max benefit, but it does not include bridges, dentures, or implants. So be careful selling that. I would stick with 50 and 70. It is the PPO and Premier network for Delta Dental. Commissions. So we do pay for Medicare Advantage, the CMS Max. We also have a $100 certification reimbursement if you write 10 new to HAP for 1/1 effective dates. You can get the $100. We don't care what certification platform you take. New this year, really excited about this for January 1st. For people moving from one carrier to HAP, currently under CMS guidelines, we have to pay $270, so it's considered a renewal. So if they move, for instance, from Blue Cross to HAP, we would have to pay $270. We currently pay as earned. Starting January 1st, we will actually pay the first year as a lump sum. So you move them from a competitor to HAP, you'll get the $270. We pay it the month after the effective date, so you'll get paid in February, that $270. And then come the renewal, so the following year, then that's when you'd start getting it over 12 months. So we're really excited about that. It should help a lot of the new agents that are getting started in this business. Value-based enrollment. So another way to earn an extra $50 per application you complete is through VBE. So through our online enrollment platform, Ascend, at the end of the Ascend application, you'll be asked if you want to complete the value-based enrollment. And it'll say, do you want to schedule now or later? What this is currently your clients are mailed what's called a health risk assessment every year to help us get their medical information updated in our system. Next year, because we're just not getting a lot of those back, we decided to make it online. So what'll happen is if you say schedule now or in the future, your client, based on the phone number you put in the application, is called from our call center, and they are asked a 15-minute survey, which is the health risk assessment. Once they complete that, every month we will pay out a $50 service fee for every client you have complete the VBE. So not only can you get the renewal of $270 as a lump sum for clients you move, you can also get the extra $50 as a service fee for the VBE. So we are really excited about that. If you are not using Ascend, let us know. We'll get you hooked up. If you're using it through one of our competitors, we could still get you enrolled to use it through HAP. So just send me or my Jason an email at the end of this, and I will give you my contact information once we get to the end. Medigap plans. So obviously we've made some big investments into our Medicare Advantage plans. We also looked at the Medigap plans, and we are seeing a huge transition here. And what we're seeing from Medigaps is that switch rate from Medigap to Medicare Advantage. This past year, 2020, was the highest switch rate in history. Almost 6.5%, I think, was the number of the people on a Medigap switched to a Medicare Advantage. And I'm not saying Medigap plans are bad. We're just seeing a lot of people switching. As the premiums going up, people getting older. So we decided that we wanted to make an investment in Medigap, so that way they have a HAP Medigap. So when they turn 70 or 75, if they do change to a Medicare Advantage, they're probably going to choose the company they have the Medigap with. So we made a large investment into our Medigap plans. We have plans A, C, D, F, G, and N. As you know, because of macro rules, if they're new to Medicare, they cannot get plan C or F. We do guarantee issue for loss of group coverage for plans A, C, D, and F. We do not do G and N. We do guarantee issue for plans G and N if they're new to Medicare or turning 65. So G and N, new to Medicare, turning 65. The reason we do that is to control the risk pool and keep it more, I guess, safe. By allowing loss of group coverage, you put yourself at risk for people that are 70, 75 when groups move people off their plans. So we decided to preserve plans G and N. Our plans are portable, so if you have a plan G or N Medigap, you can take it with you if you leave Michigan and your rates don't change. So pretty excited to mention that our plans are portable. We do have a household discount. So we do give our members, so if you have 2 people in the house that enroll in a HAP Medigap plan, we will give them each a $10 PMPM discount. We have extra benefits. So we're one of the first carriers to introduce a gym membership on our Medigap plans. New members and existing members will get the gym membership next year. And as I mentioned, it's the same gym membership we added to Medicare Advantage. So our clients will have the PeerFit Move, which means they can go to lifetime. So our MedSup clients could actually go to lifetime. So one of the first carriers doing that. We also are going to make our dental options, the two plans that I talked about earlier that I really like through Delta Dental with no waiting periods, available to buy up on our MedSup. So they won't have preventative built in, but they can do the buy up dental, which does have preventative built into it. So one of the first carriers you actually do to be able to do buy up dental and not have a waiting period for any of the benefits. We also include Assist America, the worldwide travel benefit. Here's the dental plans, very similar to what you just saw on the Medicare Advantage plans. Not a lot of differences there. As far as rates go, we are very competitive. We are in line with the local companies here in Michigan, which would be like your Priorities, your Blue Crosses. People always say, well, you're not in line with those national carriers. No, that is the truth. We are not. And I'll tell you the reason for that. We do not pool our rates. So what does pooling mean? Well, it means that when we come out with new rates, they apply to our entire group of people. So everyone that's got a MedSup plan with HAP, doesn't matter if you've been with us for 15 years, when we come out with the new rates, those rates apply to you. So I'll give you an example. You buy our plan at 65, you are now 75, and HAP comes out with our new rates. You can look at this chart. So if you have clients with us, you could basically show them this chart. A male, Plan G, 75, they're going to pay 183. What companies do that pool their rates is every 5 years they move those pools on. What that allows them to do is have huge rate increases on those existing pools while showing lower rates to new members enrolling with them. So I'm with one of those national companies. I've been there 10 years. I see the rate come out at 183 for a 75-year-old male, Plan G. I'm like, oh, that's great. But then I get my renewal letter and mine's actually 250. So we don't pull our rates, makes it easy for you to, as an agent, to kind of see what's going on. But that does make a difference, which is why we charge a little bit more in those first couple of years, because we can't kind of get you in the back end. For our service area, we do have the entire state of Michigan. Compensation. So for the plans that you can sell with us, DG and N, the main ones, we do pay $250 over 10 or $250 a year for 10 years. $250 a year for 10 years. It is paid as earned. So as I mentioned earlier, we are seeing Medigap members not stay on the books for very long. So I always say over a 10-year period, we pay the highest comp for Medigap, $2,500. I think the next closest one that I've seen is like $2,415 or something. However, the clients aren't staying on the books for 10 years. Average Medigap clients right now, a little over 6 years. So if they're not staying on the books that long, it doesn't make us the highest compensation. So we are introducing a bonus program for next year. It's going to be a quarterly bonus program, and it's going to be based on how many you write per quarter. So if you write 3 to 5 Medigaps per quarter, 150 per app. 6 to 10, 200 per app. And if you're writing 11 plus, which is basically 4 Medigaps a month, you're going to get an extra 250 per app. So really excited about this bonus program. Means our agents that are writing 4 a month can basically make $500 per app. To order supplies, we're going to talk about our online enrollment, which I highly recommend agents using our online enrollment instead of doing paper apps. It just takes time. It also creates errors, and you can't track it very well. So we're pushing online enrollments, but if you do need kits, you can actually order kits. Our kits will be available. I actually sent out an email a couple days ago yesterday regarding this. You can order kits starting, I think, Monday next week. If you order them with it by the 27th, you will have them in hands by October 1st. If you have questions on how to order your kits, you can send an email to myself or Jason. There'll be contact information at the end. But if you do need kits, you can order them. Some agents that if you wrote 5+ last AEP with us, you will automatically be shipped a starter kit. Our online enrollment. So I'm very, very excited about our online enrollment tool. So with COVID, we think that a lot more agents will be doing phone enrollments and not so many in-person enrollments. So we want to invest heavily into our online tool. So I'm going to tell you why you need to use Ascend and why I think it's the best thing in the world. So Ascend is our online enrollment tool. There's a bunch of things that the online enrollment tool will let you do. The first thing is you will get your own hyperlink. With your own hyperlink, you can actually send that hyperlink to your clients You can post it on Facebook or social media, any other social media. You can put it on your website. If someone clicks on it and enrolls in a HAP plan, you are automatically credited to it. So that I think is very helpful. You can do text scopes. So say, for instance, you're talking to a client on the phone and you want to get them the scope now, you can text it or email it to them using the Send platform. It's super easy. They get a text almost instantly. They click on the link, they click accept, that's it, they're done. You can verify their LIS status, so you can check LIS status. You can check drug costs, if pharmacies and providers are in network. The nice thing about this next year that we're doing is two things. One thing is called a quick quote, which is where you can actually, as you're going through the quotes, and say, for instance, you pick two plans, you have an HMO and PPO, and the client says, well, I want to see the information. You add those two plans to an email in the system, click send. The client gets the information, they can apply for one of those plans, and you're credited. The second thing you can do is, say, for instance, you're talking to the client on the phone and you're not recording your call, which is a CMS thing you have to do. The way to get around that is to send the application to the client for signature. So our program now with Send will have a button you click at the end of the application, Send for signature. The client gets two emails. One has a code and the other is the link. They click on the link, they input the code, they click sign here, which is just a button, and they're done. Now you are 100% CMS compliant and you did not have to record your calls or file a script for CMS approval. So if you are going to do telephonic enrollments, this is the platform you need to use to make yourself CMS protected. So really excited about the Send platform. You can also track your business in there. And there's a lot of other things the system does. Plus the application is extremely easy. So if you're not using a Send, please email myself or Jason and we'll make sure we get you hooked up for HAP. But this is the way to go for 2021. Almost done. Certification. So as far as certification goes, this is counts towards your in-person / webinar attendance. So you'll be good by being on here. And I see the 5 or 6 of you that are on. Then what you also need to do is you need to go to Miramar-Agent if you haven't already. You'll go in there, you upload your AHIP or pinpoint. And then once you do that, you'll take the HAP product test. Pretty easy test. And then once you take that, pass it, you're good to go. I will tell you, there has been one question that is catching everyone off guard. And it's basically for our DSNP, what level of full Medicaid they have to do. The question's actually, there's two answers, but only one of them is right. The correct answer is QMB+. So I'm giving you a hint on there. Full Medicaid for DSNP, they have to be QMB+ according to the question. But actually they can be QMB+, FMBD, SLMB, and so forth. So QMB+ is the correct answer. Last thing is our contact information. So one thing we try to do at HAP is we want to make it as easy to do business with us as possible. We also want to be the place you go whenever you have questions. So if you need help, you have questions, Jason and myself, we're text away. So you can text us both and just hope one of us responds. We literally sit here like on these webinars and stuff all day. I watch my phone so I can send texts while I'm doing these presentations. So if you ever have anything, just text us. It's the quickest way to get a hold of us. And then, for instance, what you can also do, or not for instance, but what else you can do is email us. So if you do have questions and they're not so urgent, email. You can also call us. We also have a general hotline. So you can email or call that general hotline. They are open from 8:30 to 4:30. For contracting commissions, I would say go through IED to get help with that before you reach out to us, because we don't want to mess anything up for you. Especially if you're contracted directly through IED, it just all depends. So start there, and if you still need help, you can reach out to them, or you can always email myself or call me. So that is the presentation. Like I mentioned, if you can't tell, I'm pretty excited about this next year. We did do a lot of investments, made a lot of changes. Jason is your main contact. He replaced Kevin Cox. Kevin actually became an agent. So Jason, he's been with us for 14 years. He's been with HAP since 2014. He's been in the Medicare side for 14 years. He knows the DSNP market, the Medicare market in and out. So we feel like we are, between the two of us, a great resource for you. We hope that you choose HAP. Like I said, we want to make it as easy as possible. we want to be the carrier you choose for 2021. So if there's anything we can do to help you, let us know. If you're running into any situations where you're struggling or need help, let us know. And I also think this year is a big opportunity. Despite COVID, I think it's a big opportunity. I mean, you got one of our competitors, that Blue company, is basically canceling 4 major plans with about 30,000 people in the Tri-County area enrolled in it. So there's a large opportunity to basically pick up business. Someone asked about the slides. Yep, I will send, or Christy, I'll send Christy that presentation, and then she can get this out to everyone that attended, since I did make some updates to it. But is there any other questions? I know I kind of went through that fast, but is there anything else?
It looks like it was just that question, and thanks for asking that. We will get those slides out. As I mentioned, this is recorded, so we will have it housed in our YouTube library. You can go back, listen in again, and I would recommend it just before we get into the selling season, just to get yourself comfortable with those plans, especially the PPO, the $0 PPO plan. But Dustin, thank you so much for that great presentation. Not only is HAP a great carrier and great carrier partner, they show us by what they're doing with these bonus dollars for MedSup, for the $50 completing the VBE, that they appreciate agents. And so it's always exciting and helps agents keep loyalty to a carrier that does show that appreciation. With that being said, also HAP has some great pre-approved marketing pieces. Don't forget about that. Come to me, ask me. If you don't know where to find them, I can help you through your agent portal. They're housed there, but we can put your contact information. You can use those marketing pieces as well. IAD is here for you. Feel free to contact us, as Dustin mentioned. Call us about your contracting and your commissions first before you reach out to Gina or to Sangria, and we'll be happy to help out. So with that being said, thank you so much again, Dustin. We appreciate your time. We appreciate our agents. Oh, it does look like we have one more question here before we wrap up. Can the dental be purchased as a standalone?
No, no. So it's embedded. That's the way we're able to make it so rich. So they have to buy the HAP Medigap or Medicare Advantage plan to get the dental.
Which that does lead me to, I want to clarify that. So if somebody has a client in a MedSup currently in this year, and along comes January 1, will they automatically get that fitness, number one? And how will the dental opportunities present themselves to those existing clients?
Yeah, so the gym membership they'll automatically have, and in their letter, their renewal letter, it's actually going to mention the gym membership, so they'll automatically get that. In the renewal letter this year, it's also going to mention about adding dental, and they need to add the dental prior to January 1st. And in the renewal letter, it'll give the customer service line. So they basically just call customer service and say, I want to add dental. And that's pretty much it. It's as easy as that.
So it is not an additional commissioned product. Is that correct?
Yep. The dental on the Medigap and Medicare Advantage is not commissionable.
Okay, that's great. It's so nice that folks will have an opportunity. So many times with MedSups, they have to go to a standalone plan, which, that's great. And some of them are, okay. The networks aren't always wonderful. And there's always a waiting period of either 6 to 12 months. And so, boy, I'll tell you, if you've got somebody that needs some dental work pretty quickly, I would push them right towards HAP, because there you go. No waiting.
Yep, for sure.
Okay, guys. Thanks so much. Appreciate your time again. Thanks, Dustin.
Thanks. Bye.
Bye.